go fast and deliver something provocative.
This is a rare chance.
You have the future in your hands.
The status quo can no longer be.
What's your role as PTs?
Each person here is an innovator, leader, and visionary in their own field.
PASS is the first of its kind event for this profession. We consider it a tremendous opportunity and responsibility to look into the future with our friends and colleagues in other disciplines and among ourselves.
We extend an invitation to let your imagination run wild.
I didn't know what to make of it when the program organizers told me they were going to put me in a pit with 30 physical therapists while 60 other PTs watched.
Healthcare reform will happen. What's not clear is what the healthcare reform will be.
What will be ahead in the next 6,000 days?
I think you're going to need to know molecular medicine, behavioral medicine, pharmacology, health services research, and information technology in addition to the disciplines you know now.
The two first visits that I did in this modality, one was back pain, the other was knee pain. And I had the patient lift his knee up to the screen and made the diagnosis of a medial meniscus tear. But the patient was not in my room.
With technology, patterns of care will change. We need to understand what those systems are and how we can interface and change with that.
In the stimulus package, there is $1 billion for prevention and wellness.
How can we make that $1 billion work to really get the kind of change in our healthcare systems to put the priority that every person in this room recognizes needs to be on prevention?
If we can do what we did for smoking with obesity, a lot of these problems will be solved. It's going to take that kind of a national war, if you will.
The healthcare arena is a competitive thing in Washington between the pharmaceutical companies, specialty groups, medical device manufacturers, but the PTs hang in there very well and punch well above their weight class.
I want you to seize this opportunity to do really great and meaningful work.
We were looking at practice guidelines that are actually based on data that either is already there or needs to be gathered.
The issue for me is not going to be on being challenged on the guidelines. It's purely about going to be challenged on the cost effectiveness of one versus the other.
If all we cared about was cost, we'd look for some kind of cost minimization approach. And I agree with you, we wouldn't care about a process. But I think what we're trying to do is optimize the effectiveness given the time, and you do need to get to guidelines, you do need to get to best practice principles.
Instead of being competitors, maybe we need to form alliances more, and that way we can disseminate and information among ourselves a whole lot better.
Four years ago, at the age of 33, Nicholas suffered a TBI resulting in extensive frontal lobe damage caused by a 30-foot fall from a tree. We were on a family trip in New Zealand, where healthcare advocacy is seemingly not a necessity. Presently, we have a team who are collectively dedicated, enthusiastic, and committed to Nicholas's recovery. Taking the lead from the PT, who immediately incorporated speech therapy as an integral part of her treatment, everyone has realized the value of carrying through each other's therapies, and this is the outcome.
Personally, we are convinced that without a committed caregiver advocate, not only willing to act but also to create opportunities, our son would not have progressed to the level he has attained in 4 short, or depending on one's perspective, long years.
I would ask for your personal commitment, each of you, to do what it takes to ensure the goals of PASS will be realized and to make sure what you've learned here gets spread.
I'm going to try and propose some type of partnership.
The connection between us all is something that we're all going to have to work on together. One of the things I'm going to commit to do is look for already successful models.
I'm also going to go to our state legislators too.
Don't limit yourself to what we've always known in the past, but what we can be. And there is no limit.
We create the future. We can't predict the future. We need to go out and create it. And so I really think that we need to move beyond our comfort and go out and create our own future.